Thank you, Dr. Khanna. And that was a very interesting and informative session that covered everything about the superficial venous reflux, and including the deep veins too. And uh, uh, I have a special interest in phleboarthrosis because this is a topic that we are trying to promote and propagate, and um, the way in which we are seeing the afflictions of the joints of the lower extremities, especially the knee and the joints of the foot, including the ankle and the small joints. And what we're seeing is that superficial venous insufficiency is being missed in all of these patients, and there is a reason to it, that not all varicose veins are visible. And there are a few spider veins here and there, and then these patients go in for degeneration of the knee joint, which has ultimately reaches a stage where then it is justified to replace it. However, prior to that, we believe that there is about a 10-year window period during which this can be quite well controlled. And if it is controlled, then a knee joint replacement can be delayed or maybe postponed for the rest of the life of the patient. But to recognize this, we require more and more propagation of this idea. Recently, Professor Uhl, who also has quoted our study in his most recent publication, has mentioned about the perforators that come out from the bones, especially the intraosseous osseous perforators. So when there is congestion of the knee joint or any part of the lower extremities, then you can understand that nutrition suffers. So that is my comment about the most important talk that we had today. And of course, if there are any questions, then can we direct them to the speakers? But that's what I want to comment today. Thank you, Dr. Khanna.
Thank you very much. I mean, it's a very interesting concept. We still have to prove it, whether it's a cause and association relationship, or it's just, it's associated with osteoarthritis, or whether it's a cause of osteoarthritis. And time would tell in the larger studies, but it's definitely a very, very important concept. And I believe because of the reasons you gave, it probably would be one of the important causes to prevent or at least retard osteoarthritis in these patients. And it was a very wonderful session. We're covering everything from lasers to physiology of varicose veins, lasers, thermal ablations, and also non-thermal treatment. Thank you so much, Dr. Patel. And